Total Performance Physical Therapy. Today we're going to talk about the difference between golfer's elbow versus tennis elbow. And let's just clarify the fact that you don't have to golf or play tennis to actually have either one of those. It's just more the motions of the sport that they've gotten those nicknames. But just because you've never picked up a golf club, never picked up a tennis racket, doesn't mean that you can't have golfer's elbow or tennis elbow. So golfer's elbow and tennis elbow both refer to pain at the elbow. The difference is one's on the inside, one's on the outside. The inside and the outside will also depend on which muscles are afflicted and exercises that we need to do. So it is important that we determine exactly where it's coming from. The other thing is that with golfer's elbow and tennis elbow, it's usually a product of something going on at the shoulder and even the neck. So even though you might have pain only in the elbow, you always want to make sure that you're looking at your wrist, at your shoulder, at your neck to make sure that it is not anything coming from up here or anything coming from down here. So let's talk about the difference between golfer's elbow and tennis elbow. So golfer's elbow is going to be pain on the inside of your elbow. There's a little bump on the inside of the elbow. If you just kind of rub around, you'll feel like it's your bone. That's where usually point tenderness is. When we deal with golfer's elbow or tennis elbow, you're going to have very specific right there pain. Generally it's not, it's kind of here, it's all down in here. Those two types of injuries are ones where this is where it hurts. It's this spot right here. It's very, very painful. So it may be part of what you have going on if you have pain all the way here or up here. But usually when we're specifically talking about a diagnosis of golfer's or tennis elbow, you're going to have pain like in one spot. Golfer's elbow is going to be on that bone where all of the muscles come up and attach here. And then for tennis elbow, it's going to be on the outside. So inside golfer's elbow, outside tennis elbow. Now there's a whole bunch of muscles that are associated with that. And that's why all of these muscles come up and attach here, and all of these muscles come up and attach here, which is where the differentiator is. So couple of quick stretches you can do. Basically, you're going to just stretch your arm out. Now, if you have golfer's elbow or tennis elbow, sometimes this position can be very painful, but you want to just hold your arm out and pull your fingers towards you. You should feel a nice stretch in through your elbow. You can then reverse it. These are safe to do for either golfer's elbow or tennis elbow. One stretch is more specific than the other, but again, these are just generalized stretches for your elbow. When you're doing this, you want to make sure your shoulder's not up like this, okay, that your elbow is nice and stretched out. If you get pain with this, you want to make sure that you stop, because you certainly don't want to do anything that exacerbates it. Another caveat is if you have numbness and tingling in your fingers, that is not a symptom of elbow pain or tennis elbow or golfer's elbow. So that's something completely different. With any medical condition, you want to make sure that you consult your medical care provider. But just kind of some simple stretches, pulling your elbow, pulling your hand towards you with either your palm up or palm down is a good one. When you have either golfer's elbow or tennis elbow, you do want to also watch your finger movement. So a lot of times, a lot of finger movement, like with your phone or moving things like that, can really exacerbate that condition also. So watching how you use your phone or your fine motor skills, really important when trying to heal that. But again, you want to make sure that you consult with your provider to make sure that's exactly what you have. If you or someone you know suffers with elbow pain and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898 and we'd be happy to get you in. Thanks and have a great day.